there is going to be an entire band around my waist of skin and the entire insides of my thighs that I was born with. My belly button, they're gonna unplug it and plug it in somewhere else. My body is never going to be the same again. Hey friends, family, and anybody else who decided to click on this video. My name is Kayla Germano and welcome to my new channel. I am so excited to finally be making these videos. Recently, I have had many friends and family reach out to me asking questions or wanting information. Unfortunately, I am very busy and I get overwhelmed very easily. So I feel like this is the best way to finally give everyone the story, the advice, and anything else that I have to offer. This video that you're watching right now is going to explain everything that is happening prior to the highly invasive 7-hour surgery. I will also be talking about finding a doctor because the first appointment I went to was atrocious. It was terrible. I will also be talking about the really awkward appointments that have to happen for this kind of surgery thing. I will give you a little insight on the financial side of things, and then I'll also be going over all of the pre-op stuff and everything that you need to do before the surgery and all the things you can't take and that kind of thing. At the end of this video, I will be showing my extra skin, excess skin, that I will be getting cut off, but I will not be showing you my bare skin. I will be showing you it through clothes. I am too insecure for that, but you'll get the point. You'll see it. Then my videos after this will be more of like a vlog type style, just because it'll be me the day of the surgery and actually getting it done. Well, I mean, I won't be showing you me actually getting it done. I'll show you me in the hospital before and after, and then my recovery process for 6 weeks. And I do want to state before I begin that I do plan on making videos about how I lost the weight, the foods that I ate, the workouts that I did, all of that kind of stuff. The reason that I'm making this specific video now, which is kind of like the end at the beginning, but the reason why I'm doing this now is because it dawned on me the other day that I'm changing my body for the entire rest of my life. For those of you who don't know, I had lost 124 pounds in 10 months. My whole journey now has reached 20 months and I've been maintaining my weight for most of that time, but my whole total now is 140, and I will pop up some before and after. Oh, focus, hello, focus. I will pop up some before and after pictures right here, that way you can see. Extremely important disclaimer. I am in no way, shape, or form saying I am or look better or worse on either side of these before and afters. These examples are to show my personal journey that I decided to take. I had no prior health concerns or issues that were caused by my weight. Please remember, all bodies are beautiful, and do what makes you happy. This is something that is incredibly big on my life and my future, and I thought it'd be really beneficial to document this. I thought it would be really good for me personally to look back on, and then I know a lot of people have questions about this stuff because it's not every day you see people go through this. I don't know a single other person who has gone through excess skin removal surgery, and there's not that much information online. So I thought that this would be the best way to either inform other people if they needed to know if they were going through this kind of journey, or for people who are just curious. But I cannot give you the medical or scientific education on these kind of things because I'm not a doctor or dietitian or whatever there is. Now I will say I lost my weight by going to my doctor, asking for help, and getting help from a nutritionist. I did not take advice from online sources or anything like that. I got real medical guidance from my oh my god, words are hard. From my physician and a registered dietitian nutritionist. Everything I will talk about and explain are from my perspective of going through this journey, and these are things that I learned from my experiences and my research. I do promise that everything that I say, I'm going to keep it 100% real, what I went through, and I'm going to be as transparent as I can that I feel comfortable with. This is still a sensitive topic for me myself as I'm still going through this journey. It's hard. I hope and pray I do not offend anybody while explaining these kind of things. As someone who grew up their entire life being brutally bullied over these things, I do not wish those feelings onto anybody else. All right, enough rambling. This journey was a long and bumpy ride, so make sure you fasten your seatbelts and let's get ready to take flight. Before I talk about finding a doctor, I do want to talk about the surgery and the procedure itself. I did not know about this procedure before I had gone to see the doctors, but it's easier for me to explain why my first appointment was so bad after I explained the surgery instead of trying to explain two different things and it would get confusing. So I'm going to explain the surgery first. This was not a decision I made overnight. It took me months to make this decision. I did not just see the excess fat and was just like, yep, let's do this. Like, no, it took months and months and months to come to this decision. Oh, it's so crazy. The surgery that I am getting is basically they go from the top of your belly button to the top of your pelvic bone, and they completely remove all of that skin in the front, and whatever skin you have left on the top, they pull down and connect it to the skin that's down at your pelvic bone. In the back, they start at the very tip of your behind, and they go out as what they call bird wings. They take another whole belt out back there, and they lift the skin up back there. And then the incisions connect all the way around. So you basically have a scar belt going around your waist. Hey, it is sick me in recovery. Sorry I sound and look a little yucky. Mother Nature gifted me with really bad allergies that led into a sinus infection. The reason I'm here is because while editing this video, again, recovery, you may have noticed that the very first two clips of this video were from a completely different time, day, hair, makeup, everything. That is because I had filmed this entire video, not this one, the one you're actually watching, a whole day prior, and I'll just let you see how it went instead of trying to explain it. My doggy! Loki! My doggy! So knock that over. What was I talking about? Oh. I feel like I'm gonna have to re-record everything because I feel like I talk bad about myself too much. It's really bad. My therapist tells me I gotta stop. I really don't want to, guys. I don't have time for that. As it is, I'm gonna be editing this while in recovery because I don't have time. I have to do all of my schoolwork. I have to write a 5-page argumentative essay. So yeah, that's how that went. Anyway, I just realized that with recording the other video, I had forgot to mention a really big part of the surgery that's kind of major. It's big. I don't know how I forgot to say it, but I forgot to say it. It needs to be said. Here I am. I'm coming to tell you about the new belly button I have. When they cut the skin off from above your belly button to above your pelvic bone and take all that out and pull all of it down like I explained, they cut a little incision in the middle of, I guess, wherever your belly button would be, and they basically, I don't know if everybody has an umbilical cord. I'm not good with anatomy, but I have one. So what they're going to do is they're going to unplug my umbilical cord where it was, and they're gonna make an incision and they're gonna plug it in literally somewhere else. I have a new belly button now because this is me in recovery now, editing the video and realizing blah 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 blah, you get it. She kind of looks like an alien right now because obviously still healing. There's a lot of, you know, yucky stuff going on. It's very interesting. It's very weird. Hopefully that's the only thing I forgot to mention. Hopefully you won't have to see me looking like this and sounding like this again. Let's get back to the video. This surgery does require 6 to 8 weeks recovery, and you do have to have drains, which I think is so icky. I mean, obviously it's worth it, but drains are just yucky. For finding a doctor, when I went to my physician's office the first time, I had asked her for a recommendation. The first recommendation that she sent me was to this doctor that is very clearly more on the bougie side. I did have people recommend that I go to a city that has like more plastic surgeries going on so that way it's a little bit cheaper or whatever. That is a possibility for other people. So if you're someone looking into this, definitely if you are able to, go to a different city where it is cheaper. I personally, during a pandemic, do not have the flexibility to go anywhere else and get this done. But if you have that flexibility, like, go do it. Just make sure it's a reputable doctor, obviously, because this is intense and you can't just go to anybody. Now, it took me 2 months to get on the books for this first bougie doctor. So this first doctor that I went to, they don't do like emergency plastic surgeries, which will make sense when I explain the second doctor, but he was specifically like cosmetic. Like, you only went to him if you wanted your girls to be prettier or if you wanted your chin lifted, those kind of things. These appointments are very open. When you go to these appointments, a nurse hands you a robe and you basically have to only wear your undergarments. And these doctors come around and they pull your skin to see the flexibility, to see where it will go, that kind of thing. So this doctor comes in and he starts looking at my skin or whatever. It's fine. I'm comfortable with it. They're doctors. There's nothing weird on that side. Like, they're doctors. This is a professional setting. What I absolutely hated was this dude pretty much expected me to know everything about this surgery. I knew absolutely nothing before this appointment. There is not much information about this kind of stuff on the internet, and all the before and after pictures I saw looked nothing like me. These people didn't get the full surgery that I needed, or they were like 20 plus years older than me. He pretty much acted like the surgery was like a walk in the park, which yeah, for him it is. He does this all day. But for someone like me, where this is such a huge thing, there was no empathy and it made me feel terrible. I literally sat in my car and I cried after that appointment. Like, it was so bad. Also, I'm not going to talk about the financial situation for the one that I actually chose, but I will tell you this one so you can hear how ridiculous this is. Not only was this dude non-empathetic in any way, shape, or form. Why does this look so much different than before? Does this look different than before? I feel like this looks so much different than before. If it does, sorry, I had to reformat my memory card. I don't know, this thing is weird. What was I saying? Not only was this dude non-empathetic in any way, shape, or form, but he also wanted to charge $30,000 just for him to do the surgery. That is not including the hospital stays, the anesthesias, anything like that. I was looking at like a $35,000, $40,000 bill for someone who didn't even care. Also, he told me that the only way he would do the surgery is if he was gonna do the waist part first. I would have to wait 6 months and then get my legs done. That was gonna put me out of work 2 times now. I was gonna have to go through 2 separate surgeries, 2 separate recoveries. It just sounded insane. That also would have been 2 separate hospital stays, 2 separate anesthesias, so I was honestly probably looking at like $45,000. Anyway, so yeah, so I went straight into my car and I cried after all that, and I called up my doctor and I was like, hey, I need a new referral. So my doctor's office told me that they only have one other referral that they could give me, and I was like, just give it to me at this point. Had to wait another 2 months to get an appointment. I don't know if everyone's getting plastic surgery during the pandemic or what, but like, it was so hard to get these appointments. After how the first one went, I was obviously very nervous and anxious for my second appointment. What? Go away. I don't care. As I'm sitting there waiting impatiently in my undergarments and my robe in the doctor's office, this doctor does a lot of breast cancer patients. And of course, while I'm sitting there, you know, just all anxious and nervous and stuff, he had to go do an emergency breast cancer surgery, which obviously, please go be with them. They obviously needed it more than I did at the time. But you could see how that started making me sweat and stuff and go crazy. However, when this doctor did come in, oh my gosh, night and day. He explained every single little detail. He pulled me in front of a mirror and literally like pulled my skin down. He was like, obviously it's not gonna look exactly like this, but like it's gonna look somewhat like this. Like, are you okay with that? Pulled it up in the back and he was like, by the way, you know, pulling it up, like it may flatten your behind a little bit. Like, are you gonna be okay with that? If you're not gonna be okay with that, like, you know, I could take fat from another area and put it in there, but it'll be a whole separate thing and blah, 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 blah. He understood how hard I had worked to do this and he respected it, and he was constantly asking for consent, and I just respect it so much. It made me feel so much better. He also was able to tell me that he could either do it in one whole sitting or in 2 separate surgeries. Obviously I chose the one because I don't have the flexibility to miss work twice in a year, okay? He also went through and explained every possible risk that could come out with a surgery. Like, you know, like those weird things at the bottom of commercials that are like, you might go paralyzed for the rest of your life. Those. I mean, he went through every single little thing. I'm just so appreciative for it. Oh my gosh. On top of all that, he tried so hard to get my insurance to cover this. Now, obviously my insurance laughed in my face and was like, huh, we don't pay for any kind of plastic surgery. But he tried, and like, it's so big. That's why I'm saying, like, go to as many different appointments as it takes. If you're going to do this kind of thing, go to as many appointments as it takes. Go to as many doctors as you can see to find the right one. These are big things. You don't want to just go to anybody. A month after that surgery, they had given me a quote 2 weeks after that surgery. Unfortunately, the quote had as if insurance was going to cover it. Insurance came back and said, no. And then I had to wait another 2 weeks for a new quote. After I got the new quote, you have 2 months to accept that quote. Otherwise, you have to go back to another consultation and get it all done again. After I had gotten the quote that was without the insurance, it was so much better. I'm not talking like, you do not want to pay too little for these kind of things either. You don't want to walk out looking botched. This is such a big surgery, you know, you kind of have to expect to pay a little bit more. But he included a hospital stay and the anesthesia in his price. So that way I don't have to worry about getting backhanded with a $5,000 bill from anesthesia. And they will do that. Trust me, I know. So it took me about a month before I had gotten my whole financial situation figured out and ready to go for this. Again, I'm not going to explain that part just because it is me personally financing it. I just don't want to put that out there. But I will let you know, to get an appointment, you do have to put down a $1,000 down payment, and that is how you get your appointment. With this specific surgery, since I decided to get it done all in one day, I basically am his only patient for that day. So I had to get him on a day that was completely unbooked, nobody else that day. Now, this was back in October, and at the time the woman on the phone had told me that his first available appointment was January. I needed to find a time that was going to work with my work schedule and my mom's schedule because she was going to be the one to drive me to and from the hospital. For those of you who don't know, I am a nanny full-time, and I'm also a full-time student in college. So it was kind of hard figuring the schedule part out as well. But I decided to choose the week of Easter because my mom would be home. I didn't want to do the summer because 1, I'm still going to have summer classes, and 2, I want to be there for my 2 little ones that I nanny over the summer because they're both going to be home instead of while school's going on. After that, put the down payment down, you know, you get your appointment day, whatever. Then they set you up for a pre-op appointment, pre-operation. And that is 2 weeks before the surgery. So mine was 2 weeks ago. Today is Tuesday. It is 9:15 at night, and I have to be at the hospital 5:30 a.m. the day after tomorrow for this surgery. I kind of hesitated on this. Anyway, so the pre-op appointment comes up 2 weeks before your surgery, and basically the doctor checks everything again. He took his own photos of me, obviously for his record. During that appointment, they also go through like all the restrictions of all the medications and vitamins that you can't take, and I never realized all the different vitamins that you can't take. And basically by all the vitamins, I mean all the ones that help me sleep, like melatonin and licorice root and valerian root. You can't take those 7 days prior to your surgery. I haven't slept in days. What's sleep? I don't know. I haven't slept. So yeah, pre-op appointment, obviously they just give you all the information that you need before the operation, and they also give you the information because most of the people that get this surgery done are older mothers who have had kids and they have to get their muscles basically reconstructed. For me, since I'm younger, whatever, I only have to get my skin cut, so I should be pretty good on the recovery side. Now, I do want to say this for anyone who is not comfortable to ask their doctor this if they do go through to go get this surgery. I was like, hey, should I be as soft as a baby's bottom down there? If you get what I mean, I'm talking about, you know, in the area. And he said yes, it helps them a lot because it helps them be able to draw the line, that way they know where to go and it doesn't get stuck in the stitches and all that kind of funky stuff. That way they can try to hide it as much as they can. You know, with plastic surgeons like this, or plastic surgeries like this, you basically become their art piece. They don't want you to come out looking botched. You are their work. They want you to come out looking as best as you can. They want you to look and feel as best as you can, or at least you need to find a doctor that has that mentality. The day after the pre-op appointment, you get a phone call from the anesthesia people and they're pretty much like, hey, what medications do you take? Okay, you can take this, you can't take this, don't do this, don't do that, do this, whatever. All the basic things for like almost any surgery. Then, you know, pandemic, COVID's going on. 4 days prior to my surgery, had to get a COVID test. Again, I am less than a day and a half away from the surgery, so I already had mine the other day, came back negative. But the tests are a lot easier than they used to be. They used to like go up there and like touch your brain. Now they just go around at the bottom. It was super simple. I mean, it tickled, but it was nothing. What I didn't realize is that I've been in the group for the vaccine for like ever, and I didn't realize that. And so I would have got my vaccine before, that way I didn't have to do that. But now it's too late and I'm gonna have to wait until after I recover. And if you do have the vaccine, you can get your surgeries done without getting the swabs. The night before the surgery, I do have to take a shower like I normally would, and then after that I have to wash with a specific antiseptic soap that they provided for me. Also, the morning of, right before I go to the hospital, I have to do the same thing. I have to take another shower and use this soap, and they gave it to me already so I can show you it. Oh, if it stops focusing on me. This is the soap. Apparently it makes you really, really, really dry. So I'm not looking forward to that, but I also totally get it. Like, I need to be as clean as possible. They told me that they were gonna call me the day before the surgery and give me the time to be at the hospital, but they actually called me today. So I got the phone call and I have to be there at 5:30 in the morning. Yay. So yeah, basically I'm gonna show up 5:30 in the morning. They're gonna prep me. They're gonna draw the lines. They're gonna show me the lines. And then they're gonna send me under, and I'm gonna be under for 7.5, 8 hours, whatever. I know hospitals are really weird about filming. I don't know if they're gonna let me film on this camera, but I mean, iPhones these days can film 4K, like 60 frames per second, so there will be filming in the hospital regardless. Now, before I get into showing my extra skin, which I'm about to do, I do wanna say both plastic surgery doctors, I showed them the extra skin on my arms and they were pretty much like, yeah, there's absolutely no point in getting it cut off. They said that the scars and the surgery and the money that it would take is just not worth it. It does not look that bad. It actually really doesn't bother me. It only bothers me from certain angles, but you can see like there's just a little bit there and a little bit there. But I feel like, cause like your girl's been building muscles, so when I flex it doesn't look too bad, but I feel like if I build some more muscles up, but I mean overall it really isn't that bad, and it's actually a lot smaller than what it used to be. I keep putting lotion on it and, you know, massaging it for a while. I think that collagen biotin, I think I can get it down after a while. I think I'm gonna be good. But just the fact that both plastic surgeons were completely honest with me and they were just like, no, like don't even do it, it's not even worth it. So there is that. There are sometimes going to be times when you have the extra skin and it's just not going to be worth it to get it off. All right, so let's look at this extra skin. This is going to be tough for me. All right, so basically there's no way of me doing this with my face in frame as well, so it's going to be really awkward. This is my before before, so, you know, I'm obviously going to show my after when I get there. You can see it through the leggings. Like, there is, whoop, let me get in there. Whoop. There is just, it's just skin, and I mean, there's a little extra fat in there, but it is mostly just extra skin all the way around that just kind of hangs around, whatever. There is a little, you can see I've been working out. You can see the muscle walls, but you can also see there's just a little bit of extra skin up here. When they take it off, it's going to be pulled down. He said it's going to get rid of that. Now, to show you the area, top of my belly button is here, top of my pelvic is here, and I can lay my entire hand there. This whole thing is going to be cut off, and it's going to go out into the back. It's going to be pretty big. My thighs, whoop, and you can see my skin up here. It's just really uncomfortable. So all this is going to be taken off. The scar is probably going to start around down here, come up, maybe a little bit over, but it should just stay down here. I wonder if I can get it while I'm sitting down. You see what I mean by like the tube? You can see what I mean by like the floaty and how it is uncomfortable, okay? I'm not saying extra skin is ugly. I am not saying extra skin is bad. I am not saying that in any way, shape, or form. Extra skin shows you how hard you worked and how motivated you are and how determined you were. My thing is, it is uncomfortable. That and other things, like I said, I'm going to explain in other videos, but I do want to state, I am not saying extra skin is bad. What I am saying is what I'm going through is very uncomfortable and I need it off, okay? That's what I'm saying. Nothing less, nothing more. That is it. So yeah, so those are my before and afters. I think that's about all I have to say for now, at least. Now, I'm sure most of you already know the drill with YouTube, so I'm probably going to sound like a broken record right now, but if you can, please leave a like on this video. It'll help me a lot. If you have any questions, comments, or concerns, you can comment in the comment section down below, or you can message me personally if you know me. And if you want to see more of my videos or more of what I'm going to talk about, then go ahead and hit that subscribe button. Again, help a girl out. That is it for now. I will see you probably somewhere around 4:30 in the morning prior to my surgery. What else? Uh-oh. I forgot what I was gonna say. Thank you so much. Have a good night.